What doctors really think about senior memory loss. 5 ugly truths. Every older adult must hear. If you're over 60 and forgetting recent conversations, misplacing your keys multiple times a day, or struggling to recall familiar names, what your doctor isn't telling you could change everything. The truth is, most physicians are thinking things about senior memory loss that they'll never say to your face. Some of these truths are uncomfortable. Some will make you angry. But all of them could protect your independence and your future. I'm about to reveal 5 hard truths that doctors know but rarely share with their patients. These aren't theories or opinions. These are medical realities that every older adult deserves to understand. Before we dive in, I need you to know this. What you're experiencing might not be what you think it is, and that changes everything. So stick with me, because truth number 5 is the game changer that could literally save your mind. Today, I'm pulling back the curtain on what really goes through your doctor's mind when you mention memory problems. You're about to discover 5 uncomfortable truths that most physicians know but hesitate to discuss openly. Here's exactly what you'll learn in the next few minutes. First, why your doctor might be dismissing your very real concerns and what outdated beliefs are still driving their responses. Second, the shocking percentage of memory loss cases that are completely reversible, yet doctors often miss them entirely. Third, the uncomfortable reality of healthcare ageism and how it's affecting the quality of care you receive. Fourth, why waiting to address memory changes is the absolute worst thing you can do, and the critical window you're working with. And fifth, the surprising truth that your memory problems might have nothing to do with dementia at all, and why that's both good news and bad news. Make sure you watch all the way through, because truth number 5 includes information that could completely change your approach to memory health. If you want to stay sharp, independent, and in control of your future, you cannot afford to miss what's coming next. Truth number 1: memory loss is not normal aging, but many doctors still treat it that way. Let's start with the first ugly truth that doctors know but don't always emphasize. Here it is: significant memory loss is not a normal part of getting older. Yet many doctors still act like it is. Studies show that about 40% of people over 65 experience some memory changes. But here's the critical distinction. Those changes should be minor and manageable. We're talking about occasionally forgetting where you put your reading glasses or taking a bit longer to remember someone's name. That's normal aging. What's not normal? Forgetting entire conversations that happened yesterday. Getting lost driving to places you've been going to for years. Struggling to follow a recipe you've made dozens of times. Having trouble managing your finances when you used to handle them easily. These are red flags, not normal aging. So why do so many doctors still tell patients it's just your age when they bring up memory concerns? It comes down to outdated medical education and persistent myths in healthcare. Many physicians were trained decades ago when it was commonly believed that significant cognitive decline was simply inevitable with aging. That belief has been thoroughly debunked by modern research, yet it lingers in medical practice. The result? Patients with legitimate memory problems get dismissed instead of evaluated. They're told to accept it and go home. This is not only frustrating, it's dangerous. Because when real memory problems are brushed off as normal aging, the actual causes go undiagnosed and untreated. Here's what you need to know about what's actually normal versus what demands medical attention. Normal aging might mean you occasionally forget an appointment you made last week, but you remember it later without help. Abnormal, forgetting appointments repeatedly and having no recollection even when reminded. Normal aging might be forgetting a word temporarily, but describing what you mean. Abnormal, frequently having trouble following or joining conversations. Normal aging is occasionally needing help with technology or new appliances. Abnormal, having difficulty with familiar tasks like brewing coffee or using your phone. The bottom line is this: if your memory problems are interfering with your daily independence, they're not normal and they deserve a proper medical evaluation. Don't let any doctor tell you otherwise. Your concerns are valid, and you have every right to demand answers instead of dismissals. Have a doctor ever told you your memory problems are just part of getting older? Drop a comment if this happened to you, because you're definitely not alone. But here's what's even more shocking, and this brings us to truth number 2. This second truth is going to surprise you and possibly frustrate you. Ready? Research shows that up to 30% of cases involving memory loss in older adults are caused by completely reversible conditions. Let me say that again: completely reversible. Yet many doctors jump straight to dementia or Alzheimer's without properly testing for these treatable causes first. This is a massive problem because when reversible causes go undetected, people suffer unnecessarily, and some conditions can cause permanent damage if left untreated. Let me walk you through the most common reversible causes that doctors should be checking for but often overlook. First up is vitamin B12 deficiency. This is huge, especially for seniors. As we age, our bodies become less efficient at absorbing B12 from food, even if we're eating a healthy diet. Low B12 levels can cause severe memory problems, confusion, personality changes, and even symptoms that perfectly mimic dementia. The scary part: if B12 deficiency goes untreated for too long, it can cause permanent brain damage. But if caught early, the memory problems can completely resolve with simple B12 supplementation or injections. Studies have found that a significant percentage of elderly patients with neuropsychiatric symptoms, including memory loss, had undiagnosed B12 deficiency that was making their cognitive problems much worse. Next is depression. Many people don't realize that depression in older adults often shows up as memory problems and confusion rather than just sadness. This is sometimes called pseudo-dementia because it mimics actual dementia so closely. But treat the depression, and the memory issues can improve dramatically. Medication side effects are another massive culprit. If you're taking multiple medications, which many seniors are, the combinations can cause cognitive problems. Certain medications are especially problematic for memory, including some sleep aids, anxiety medications, antihistamines, and even some blood pressure drugs. Sleep disorders wreak havoc on memory too. Chronic poor sleep or untreated sleep apnea can make your brain feel foggy and impair memory formation. Thyroid problems, both overactive and underactive thyroid, can cause significant cognitive issues. Dehydration is more serious than people think, especially for seniors who may not feel thirsty even when their bodies need fluids. Even urinary tract infections, which are common in older adults, can cause sudden confusion and memory problems that completely resolve once the infection is treated. The point is this: there are numerous treatable, fixable causes of memory loss. But if your doctor doesn't test for them, they'll never be found. And tragically, many physicians skip these basic tests, and jump straight to assumptions about dementia or normal aging. This is medical negligence, in my opinion, and it's costing seniors their quality of life. Have you ever had your B12 levels checked? Have you had a thorough medication review? Most seniors haven't. Let us know in the comments. Now, truth number 3 is going to make you angry, but you absolutely need to hear it. Here's an ugly truth that's hard to swallow. Ageism in healthcare is real, it's widespread, and it's probably affecting the medical care you receive right now. Studies have documented that many healthcare providers unconsciously hold negative stereotypes about older adults that directly influence how they diagnose and treat senior patients. Let me be clear. I'm not saying all doctors are intentionally discriminating. Most aren't. But implicit bias is powerful, and it shapes medical decisions in ways that doctors themselves often don't even recognize. Here's what healthcare ageism looks like in practice. It's when your doctor gives you oversimplified explanations about your condition, assuming you won't understand medical details because of your age. It's when symptoms that would trigger extensive testing in a younger patient are dismissed in you as just getting older. It's when you're offered fewer treatment options or less aggressive interventions simply because of your age, not because of your actual health status or preferences. It's when your doctor rushes through your appointment, doesn't make eye contact or worse, talks over your head directly to your adult children, as if you're not even in the room. It's being spoken to in a condescending, overly simplified tone, like you're a child instead of an adult with decades of life experience. Research has documented all of these patterns in healthcare settings. One study found that medical students and practicing doctors often held negative attitudes toward elderly patients, viewing them as more difficult, less deserving of aggressive treatment, and less able to benefit from interventions compared to younger patients. These attitudes are completely contradicted by evidence showing that older adults benefit tremendously from proper medical care, and that age alone is a terrible predictor of treatment outcomes. But stereotypes persist, and they harm patients. When it comes to memory loss specifically, ageism plays out in particularly damaging ways. Doctors may assume cognitive decline is inevitable for you, so they don't take your complaints seriously. They may not refer you to specialists because they believe nothing can be done anyway. They may fail to investigate reversible causes because they've already decided it's just dementia based on your age alone. This is unacceptable, but it's happening every day in medical offices across the country. So what can you do about it? First, be informed and assertive. Bring a written list of your symptoms and concerns to every appointment. Be specific. When did the memory problems start? How often do they occur? How are they affecting your daily life? Second, don't accept vague dismissals. If your doctor says it's just normal aging, ask them to explain exactly what they mean and what tests they've done to rule out other causes. Third, ask directly for what you need. Request a full cognitive evaluation, blood work to check for reversible causes, and a medication review. Fourth, bring a trusted family member or friend as an advocate if you feel you're not being heard. And fifth, if your doctor truly won't take you seriously, find a new doctor. You deserve medical care that respects your concerns and treats you as a full person, not a walking stereotype. Have you ever felt rushed or dismissed by a doctor because of your age? You are absolutely not alone. Share your experience below, because talking about this helps create change. But truth number 4 is where things get really serious. Here's a truth that doctors know but don't always stress strongly enough. When it comes to memory problems, early intervention makes an absolutely critical difference. Yet most people wait far too long before seeking help. On average, people wait several years between noticing memory problems and actually going to a doctor about them. That delay can be devastating. Let me explain why timing matters so much and why waiting to see if it gets better is literally the worst strategy you can use. First, let's talk about those reversible causes we discussed in truth number 2. Many of them become harder to treat the longer they go unaddressed. Take vitamin B12 deficiency, for example. In the early stages, B12 supplementation can completely restore cognitive function. But if the deficiency continues for months or years, it can cause permanent neurological damage that won't reverse even with treatment. The same principle applies to other treatable conditions like thyroid problems or chronic medication effects. The longer they damage your brain, the harder it becomes to fully recover. Second, even if what you're experiencing is mild cognitive impairment or early-stage dementia, interventions are most effective when started early. Current medications for Alzheimer's work best when given in the earliest stages. Lifestyle interventions like cognitive training, exercise, social engagement, and dietary changes have been shown to slow cognitive decline, but again, they're most powerful when implemented early. Neurologists emphasize that there is a window of time where you can actually change your brain's trajectory and potentially prevent or delay severe cognitive decline. But that window doesn't stay open forever. Once significant brain damage has occurred, it becomes much harder to intervene effectively. Third, early diagnosis gives you and your family critical time to plan. If you do have a progressive condition, getting diagnosed early means you can participate fully in decisions about your future care, your finances, and your living situation. You can update legal documents like advance directives and powers of attorney while you're still fully capable of making those decisions. You can have meaningful conversations with loved ones about your wishes. Waiting until cognitive decline is severe robs you of that autonomy. By then, others will be making decisions for you instead of with you. So when exactly should you see a doctor? Here are the red flags that mean you should make an appointment immediately, not in 6 months. If memory problems are interfering with your ability to do daily tasks you used to do easily, if you're having trouble with familiar activities like cooking, managing money, or driving safely, if people close to you are expressing concern about changes they're noticing in you, if you're struggling to learn new information or follow conversations, if you're experiencing confusion about time or place. Any of these signs warrant a medical evaluation right away. Start with your primary care doctor. They can do initial cognitive screening and order blood work to check for reversible causes. If needed, they'll refer you to a neurologist or geriatric specialist for more comprehensive testing. Don't be afraid of getting evaluated. Knowledge is power. Finding out what's actually going on with your memory gives you the power to do something about it. Waiting and wondering just lets potentially treatable conditions progress unchecked. If you've been putting off talking to a doctor about memory changes, this is your sign to make that appointment. What's been stopping you? Fear, cost, not wanting to know? Let's talk about it in the comments because chances are many other people feel the same way you do. And now we come to truth number 5. The one that changes everything. All right, here's the 5th and final truth, and this one flips everything on its head. What if I told you that your memory problems might have absolutely nothing to do with Alzheimer's disease or dementia? For many seniors experiencing very real and frightening memory issues, the actual cause is something entirely different. This is simultaneously good news and bad news, and I'll explain why in a moment. First, let me introduce you to a condition most people have never heard of: functional cognitive disorder, or FCD. This is a real medical condition where people experience genuine memory problems and cognitive difficulties, but they're not caused by dementia or brain disease. Instead, they're related to factors like chronic anxiety, ongoing stress, persistent pain, fatigue, or the psychological impact of worrying about memory loss itself. Here's the fascinating and frustrating part. FCD can create symptoms that look exactly like dementia. People with FCD struggle to remember conversations, lose track of what they're doing, and have difficulty concentrating. But brain scans show no signs of Alzheimer's or other degenerative diseases. The good news? FCD is treatable. With the right approach, often involving stress management, treating underlying anxiety or depression, cognitive behavioral therapy, and addressing factors like pain or sleep problems, symptoms can significantly improve. The bad news? Most doctors don't recognize FCD. They see memory problems in an older patient and assume it's dementia without investigating further. So people suffer with a treatable condition while being told nothing can be done. There's another critical factor many doctors fail to address: the vicious cycle of memory worry. Here's how it works. You forget something, which makes you anxious. That anxiety makes you stop trusting your memory, so you constantly second-guess yourself. That constant self-monitoring and anxiety actually impairs your memory further, which increases your worry, which worsens your memory performance even more. It becomes a self-fulfilling prophecy. Breaking this cycle requires recognizing it's happening and implementing specific strategies to rebuild memory confidence. But few doctors address this psychological component. Now, let's talk about the medication trap. Another truth doctors rarely discuss openly. Some physicians overprescribe medications to older adults without fully considering the cognitive side effects. Multiple medications interacting with each other, what's called polypharmacy, is a major cause of memory problems in seniors. But instead of reviewing and reducing medications, some doctors just add more drugs to treat the symptoms caused by the original medications. It's a dangerous cycle that leaves patients over-medicated and cognitively impaired when they don't need to be. Here's the bottom line, and this is what I want you to take away from all 5 of these truths. Never, ever accept it's just aging, or it's probably dementia, without a thorough workup. You deserve comprehensive evaluation that includes detailed cognitive testing, complete blood work to check for vitamin deficiencies, especially B12, thyroid function, and other metabolic issues, a thorough review of all your medications and supplements, assessment for depression and anxiety, evaluation of sleep quality, and discussion of all possible causes, both reversible and irreversible. If your doctor won't provide this level of investigation, find one who will. Your memory, your independence, and your future are worth fighting for. You're not being difficult or demanding. You're being an informed patient who deserves real answers, not assumptions. Did any of these 5 truths surprise you? Which one hit home the most? I want to hear from you in the comments below, because your experiences matter and they help other people feel less alone in what they're going through. So here's what I want you to remember from everything we've covered today. The most important takeaway is this: your memory loss deserves proper investigation, not dismissal. You deserve real answers, not assumptions based on your age. And you have far more control over your brain health than you've probably been led to believe. Whether your memory problems are caused by a simple vitamin deficiency that can be fixed with supplements, medications that need to be adjusted, depression or anxiety that can be treated, or even early-stage cognitive changes that can be managed and potentially slowed. Knowing the truth puts the power back in your hands. Don't let outdated beliefs about aging, healthcare ageism, or physician dismissiveness rob you of the care you deserve. Be your own advocate. Demand thorough evaluation, ask questions, insist on testing for reversible causes, seek second opinions if necessary, and most importantly, act early. The sooner you address memory concerns, the more options you have and the better your outcomes will be. Your brain is extraordinary and resilient. Even in later life, it's capable of healing, adapting, and functioning well when given the right support. But it's up to you to make sure you get that support. Knowledge is power, and now you have the knowledge. What you do with it next could literally change the trajectory of your cognitive future. Don't wait. Don't dismiss your own concerns. And don't let anyone tell you that memory loss is just something you have to accept. You deserve better, and now you know the truth. If this video opened your eyes to uncomfortable truths you needed to hear, do me a favor and hit that like button right now. And please share this with someone you love who's experiencing memory concerns or who might be getting dismissed by their doctor. Your share could literally change someone's life. Drop a comment below and tell me, what will you do differently after watching this video? Will you schedule that doctor's appointment you've been putting off? Will you ask for those blood tests? Will you start advocating more strongly for yourself? I want to know because your story might inspire someone else to take action. And if you want to learn more about protecting your brain health and living your best life after 60, make sure you're subscribed to this channel with notifications turned on. I'll see you in the next video, where we'll dive into another topic that doctors don't talk about enough.